Everyday tasks cause Gerard Nichols enormous pain.
To walk, I'm limited down to about 100 metres. Driving a car, it can be painful because I have a manual and I have to use the clutch.
The former gardener has been waiting nearly 2 years for a double hip replacement in Victoria's public hospital system.
I'm constantly fighting the pain of it, and even sitting here now, I'm in pain.
His wait has been made worse by elective surgery bans during Victoria's repeated lockdowns and ongoing staff shortages.
I've waited 2 years and they've told me that they can't give me a time. Morally, it's degrading.
Elective surgery waiting lists have exploded during the pandemic. In New South Wales, 95,000 patients are waiting for treatment, including 11,000 who are overdue. In Victoria, there are 80,000 patients on the list. In Tasmania, there are 59,000 people waiting just to see a specialist so they can be added to a wait list.
The term elective implies that it's somehow optional. So things like hip replacements, people who need orthopaedic surgery are often very disabled. They live with a lot of pain.
The public hospital sector is really struggling.
I'll go have a look upstairs.
So it's a system under pressure.
In Victoria, the government has taken over an entire hospital just to clear its backlog.
We have seen the state government subcontract public patients to private hospitals, but that's not going to be a long-term solution.
With an election looming, there's pressure on both sides of politics to reduce wait times.
And Doctor, what does that do to help Trevor's eyes?
The states have called for the federal government to increase its share of public hospital funding from 45% to 50%, so it's an even split with the states. But the coalition says when hospitals are combined with Medicare and mental health, the federal government's share of health funding is actually 60%.
They've had 2 years to rectify the problem, and they haven't.
While patients like Gerard languish on public waiting lists, others are taking matters into their own hands. Gordon Clutterham was a keen cyclist until age caught up with his knees.
I was at work at the office and I was walking in a straight line, not carrying anything, and my left knee gave way. It just gave way. Over time it really does start to hurt. I haven't ridden a bike which is something I used to love to do.
The 69-year-old needed both knees replaced in the past 2 years, but didn't have private health insurance.
You're advised, well, you can go on the public list and wait 6 to 12 months, or if you're able to pay for yourself, it'll be 6 to 12 weeks,
So he chose to pay $16,000 out of his own pocket to have both knees done.
I was in pain. There was no real reason not to take advantage of that option. I don't want to push anyone else further down the list. My impression is there isn't a list, there are multiple lists. The sad reality is that if you're able to spend the money, you can get the surgery done.
The New South Wales government told 7:30 surgeries were prioritised based on clinical need, not payment method. Patient groups say more Australians are choosing to self-fund elective surgeries, often negotiating set fees with hospitals.
They're doing it primarily because they want to skip the public wait list for elective surgery.
A Consumer Health Forum survey found 80% of people use their own savings to fund the treatment.
Some people go to very great extremes and pull down on their super. Others are drawing on savings. Others may take out loans. Others look at after-pay arrangements.
It is not a suitable model for anyone with a chronic illness or anyone that might need expensive follow-up care as a result of likely complications of surgery. The other problem is a lot of people really underestimate the costs of surgery.
A major cause of the elective surgery crunch is the spiralling cost of private health insurance. 2/3 of elective surgeries are done in the private sector, but the federal government has signed off on premium rises of on average 4.5% each year for the past decade, which is well above inflation.
Affordability is still a real issue for people. So the next health minister is going to need to address that issue to take the pressure off public hospitals.
Now that might mean that we need to push insurers to lower their admin costs. It might mean we need to look at more no-gap policies that provide better value to people. It can be about also trying to control the costs in the health system.
In a statement, Health Minister Greg Hunt said this year the government's approved premium rise was 2.7%, the lowest in 2 decades. The industry's proposals include adjusting tax rules and rebates to encourage uptake and reining in out-of-pocket costs with bundled surgery prices and shorter hospital stays.
The commitments we'd like to see from both sides of politics in relation to private health insurance is an independent productivity commission review.
Labor didn't respond to 730's inquiries. Health Minister Greg Hunt said the government's suite of private health reforms, including changes to medical device pricing, had contributed to record levels of coverage. Patients like Gerard and Gordon would just like a system that's fairer for all.
I think it's appalling, I really do. I think Australia should be able to allocate and apportion health resources on the basis of need.
I've got a brand new fishing rod in there and it's been there for 2 years and I can't use it. It's going to end up where I won't be able to even get in the car and go out and enjoy myself. I'm not the only one. There are thousands and thousands like me.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.